Hello, my name is Dr. Kunio Chen. I'm going to talk about oral cancer today. Uh, April is the Oral Cancer Awareness Month, so that's why I'm going to talk about this topic. For those of you that is already my patient, you already heard about me talking about this during the comprehensive examination. But I'm going to talk about this here so we can actually inform people better on what oral cancer is. Oral cancer, luckily, is not a common form of cancer, but unfortunately, it's a deadly form of cancer. The 5-year survival rate of oral cancer is not high, and there's no blood tests or specific tests that are easy to find out the oral cancer. The main thing is we use our eyes to see, we use our hand to feel, and that's the only way we can find out. We do have some new technology like Velscope and other things to actually help us to screen the oral cancer better, but the diagnosis have to be made by doing a biopsy on the area if needed. So, oral cancer, what are we going to look for? Besides we do the exam on you when you come to my office every 6 months, there are a couple of things that we would like you to take a look at home. If you find something unusual, you should contact your healthcare provider, the dentist, oral surgeon, or your physician to ask them questions to see whether you need further investigation on the oral lesion. So we basically said that if look at your mouth every once in a while, and then if you see anything that you have not seen before, be it a bump, a lump, something changes color from red to white, white to red, and there's something, a sore over there, anything that you have not seen before, and it suddenly show up, and it lasted longer than a month, you should have us take a look and see. All right, things comes and go, doesn't count. You may have other issue, but at least it's usually not an oral cancer. Oral cancer, you need to be treated for it to go away. It doesn't just go away by itself. So usually if you have, let's say, a piece of burn, a cut in the mouth, they usually heal up in about 10 to 14 days. So a month is a little bit overdue. It may not still be cancer, but it is time to start to pay attention on that and see what it is. All right. So what other thing that you are looking for? Usually oral cancer, most of them are actually not even painful when you first have it. Now, usually doesn't mean always. So there are oral cancer that are painful, but usually they're not even painful. So if you don't look for that, you won't be able to even know that the sore or the lesion is there. And the other thing is, the most common place for the oral cancer lesion will be on the side of your tongue and the floor of the mouth underneath your tongue. Places that if I don't tell you to look, you're probably not going to look. Is my side of the tongue okay? Is the floor of the mouth okay? All right. So I would say that if you have an exam with a dentist and they did oral cancer screening, that's a good time that you go home and take a look in the mirror, stick your tongue out left and right and see anything unusual there. And because we really just do oral cancer screening, if everything's okay, you can use that as your baseline. And then if something's popping up, then you can actually keep track of that and see whether that lasted for a month or not. Then you should contact your healthcare provider and see what it is, do investigation. Don't panic, just tell your healthcare provider what it is. They said lasted a month, should I go for that? Is this some cancer sore that lasted a month? And we will go from there. All right. Risk factor of the oral cancer will be drinking, smoking, and more recently that we find out will be human papilloma virus. Those are the risk factors that have it. So we do recommend that both male and female have proper vaccination for the human papilloma virus to reduce the risk of the oral cancer. If you have any further questions, you can always email my office at infoinfo@onedentalcare.com, spell out one ONEDENTALCARE.com, or call our office phone number is 978-667-0691 to schedule an appointment for your oral cancer checkup. All right, nice talking to all of you, and see you another time.